Plastic surgeons are doctors who specialize in the reconstruction of facial and body defects in their patients. The patients can obtain these defects from burns, trauma, or birth disorders. Before any procedures, plastic surgeons should look into the psychological and physical health of all their patients in order to give them the best care they can. All of this information is confidential to the plastic surgeon and their patient. Afterwards, the surgeon must explain all of the risks and dangers to the surgery to their patient. Before starting to perform this procedure, the plastic surgeon must sterilize all the tools in order to prevent infection in the incision or skin tissue. Plastic surgeons perform cosmetic surgery in order to help patients with their insecurities and preferred desires for their body. This can include the reshaping of specific body parts. Plastic surgeons also perform reconstructive surgery, and this involves more of repairing or replacing body parts that have been damaged from accidents or deformities. Plastic surgeons work all over the body, unlike other surgeons, depending on the patient's desires. They have to master the skill of designing skin grafts and flap grafts in order to restore complex wounds. Plastic surgeons can also perform non-invasive procedures that do not require sedation. For example, cool sculpting uses cold temperatures to crystallize fat cells and kill them. The employment characteristics of plastic surgeons vary in many distinct aspects. First of all, plastic surgeries must have the ability to perform fundamental skills and surgical techniques, such as microsurgery and suturing. This is the final result of my suture. Second, plastic surgeons must have the ability and knowledge to heal complex wounds that can occur from trauma such as car accidents or fires. Third, plastic surgeons must be precise and extremely careful in order to give their patient the most perfect outcome they can and to minimize scarring. They can use smaller movements with their arms, fingers, and hands in order to ensure the most perfect results possible. Fourth, plastic surgeons have to maintain a calm and collected attitude in the operating room. They have to create a positive environment around them for everyone scrubbing in on the operation. Fifth, plastic surgeons must be caring and gentle post-operation towards their patients. They must ensure that their patients are happy, healthy, and comfortable with their surroundings post-operation. Sixth, it is very crucial that plastic surgeons have advanced analytical skills in order to help them group all of their patient information together and then give their patient the best treatment they possibly can. In conclusion, a plastic surgeon must be compassionate, responsible, patient, skillful, and knowledgeable in order to be successful in their job. In order to be certified, plastic surgeons have to achieve various qualifications. First of all, plastic surgeons must major in something that is pre-medical when they're undergraduates, such as biology or chemistry. Second, it is essential that plastic surgeons attend medical school. The first 2 years of medical school are called the preclinical years, where students study the basic principles of the human body. The next 2 years of medical school consist of doing rounds and being in clinical rotations at a hospital or clinic. Fourth, plastic surgeons apply to a residency program that is 5 years long. It consists of general surgery and plastic surgery. Being a resident, you are allowed more independence and freedom and can even perform solo surgeries. It allows you to be in a real-life situation in a hospital or clinic. Fourth, ambitious residents can then apply to a 1-year fellowship program where they can specialize in a subspecialty of plastic surgery, such as cosmetic surgery, breast reconstruction, or general reconstruction. Sixth, in order to be certified as a plastic surgeon, you must pass one of these exams. You can either pass the United States Medical Licensing Examination or the Comprehensive Osteopathic Medical Licensing Exam. After these medical practitioners have this certification, they are able to start looking for jobs as plastic surgeons in hospitals, or they can open up their own private practices. I was inspired by Dr. Georgas to pick plastic surgery for my HOSA project for clinical specialty. After observing him in the operating room, I was truly inspired by the artistic beauty of plastic surgery. I feel like my strengths of being a very compassionate, friendly, and artistic person would allow me to be a very good plastic surgeon. I feel that my friendly, outgoing personality would make people feel very comfortable, and I could create a very positive operating room. Plastic surgery fits into the healthcare system when it comes to healing burn victims and people with birth defects and deformities. I would love to take pro bono trips to places all around the globe and heal people with deformities such as cleft lips. I'm very inspired by the plastic surgeons who do this, and I would love to do it myself. I also adore art, beauty, and self-confidence. I believe that confidence is key to inner and outer beauty. I would love to assert this confidence upon someone and take away the insecurity that is reducing their confidence.